Thanks for watching. We're here again with our friend Doug and Team SMG, Charisma Paul, and myself, Nathan. Doug, thanks for joining again. How are you?
Oh, I'm doing great. Just had a wonderful Father's Day weekend, and thanks for having me back. So thank you.
Absolutely. Wanted to just check in again on what's new in the world of Retina, and from your world, kind of being an interesting time right now. What's going on in the field? Give us kind of a look of what you're dealing with and what some of the specialists out there are dealing with right now.
Yeah, sure. Thank you. We talked a little bit about last time about our our inventory management system, our software, which is RBMed Retina, RBMed Inventory. So the nice thing, Nathan, is with our clients, all the folks in clinics that we serve, we can see through our system how many transactions and how many injections these folks are doing in a week. And the good news is we're starting to see that trend. We're starting to see things ramp up again. So doctors are clearly starting to see more patients each week. They're doing more injections each week. I think they're being cautious. Everyone's taking a lot of precaution, but they're also being cautious about, I don't know that any of the physicians we serve or work with are necessarily at a full schedule just yet. But they are certainly starting to see more patients more frequently, and that's a good sign. And one of the other things to touch on, I think, too, is I was very impressed, and from the folks that I've talked to in the retina space, and how quickly the retina community adapted to the new protocols that they needed to put into place. As far as, PPE and making sure that they, a lot of these things, even something as simple as a face mask for their technicians might not have been something that was standard procedure for them before. Certainly taking patient temperature and limiting the number of people in your waiting room, all of those things take some getting used to. But I think the retina community has done a fantastic job of adapting to the new protocols that are in place. And the good news is we're starting to see things ramp up again.
That's great news. And, we're out in the field, we're talking to a lot of specialists, and our team is, I think we're sensitive to, the relationships in the field. And something you mentioned earlier, of course, obviously all the networking opportunities, the trade shows, conventions, a couple that we were planning on going to, they've all been canceled for the rest of the year. And this could kind of be for anyone in the group that, we're all out in the field. What are we feeling about that? You mentioned the community. How's the community kind of sticking together? And this could be kind of go around the horn, but what are you seeing there as far as some positives or just some interesting things about how the community is able to keep functioning and communicating, even though there's no events, in person, at least through the balance of the year? Paul and Charisma, feel free to weigh in on this too.
Yeah, I didn't know if Paul or Charisma has heard anything from their side, but go right ahead.
Actually, one of the things that some of the doctors I've talked to is that they seem to be using a lot more conferencing between each other, trying to keep up on what's new. And one of the things that I also heard was that there's a lot of new drugs out there, but usually at these conferences, after they release them, now they're actually having to learn in alternative ways. So, Doug, do you have any thoughts on how people are learning about some of the new products that are coming out, some of the new? In fact, some of them I heard some of the drugs are actually longer cycle between applications. What did you have to hear about that kind of thing, education?
Yeah, thank you. That's a good question. The first part of that question, as far as collaboration within the retina community and how folks are, I've seen some bigger pharma groups, bigger pharma companies that will sponsor virtual meetings, so to speak. And there's been a few, and I've been able to sit in on a few, and they really have been helpful. You get a subject matter or a couple case studies, and there have been some nice programs that have been put in place, because one of the things to touch on, I think the first part of the question from Nathan was, the trade shows, for us as vendors going to the trade shows, we're trying to network, we're trying to feature our product. For us, it's software, inventory management software, of course. So we're trying to do all those things, but a big part of it too is the collaboration and the exchange of ideas, and treatment methods, and case studies, and all kinds of different things that the doctors share among each other and their colleagues at these shows, at these trade shows. So not being able to do that is certainly something that I know the doctors are missing. And then the other obvious, second part of that question, the other obvious goal of the trade shows is to present new features and benefits of whatever product it is you have. And, for us, like I said, it would be software. But for drug manufacturers, it would be one of the big topics right now, and that's one of the more interesting, it presents some interesting scenarios, is that some of the drug manufacturers are coming out with new drugs that actually extend the treatment time, that allow patients to go a longer period of time between treatments. So right now, the standard for macular degeneration is to receive an injection every month, every 30 days or so. And again, we talked last time about how our software monitors that to make sure you're not injecting a patient sooner than you should, because if it hasn't been 30 days, the insurance company is not going to reimburse you. So what ends up happening is that, these folks are coming out and have gone through all the FDA approvals and whatnot, saying that, with our injection, if you give a patient an injection of our drug, they can go 6 months between treatments. That changes things. We talked about, I've had physicians share with me sometimes that they'll actually treat folks in a nursing home setting. They'll actually go to a nursing home once a month and treat a couple patients while they're there and do the injections there on site. Well, the idea that they may only have to go into that nursing home once every 6 months instead of every month is huge, could be huge. The other thing is, and I don't want to mention it by name, but there is a more recent drug that was just came out on the market and started to be used more frequently, and they've started to see some adverse events and some patients having some reaction to that drug. And that's where the physicians really too, when they go to these trade shows, they can talk about, and they will usually ask physicians to share what their experience was with that drug, good or bad. And that's a very quick way, those conferences are a way for these physicians to share information, share it quickly, and share it amongst each other. So, in this virtual age now, some of that information is maybe trickling out where it used to get out very quickly. I think, in any tight-knit specialty, some of the other groups that you folks work with at SMG, the sharing of information is really important to them because they want to know what others are doing in their space.
Yeah, I would second that. The networking aspect of those that want to keep moving forward, it seems like, it's come to the point where that's not an option. If you want to keep moving forward inside any specialty, you got to keep your ear to the ground on really what's going on, and not having the big, the easy ones, the big conferences.
Yeah.
It's a little more nuanced how to get that. We all believe in networking and content creation and all that, but accessing the information and accessing and continuing to build the relationship through actually seeing each other and having regular visits. Now that's kind of on its head, something we've talked about a lot is the advent of telemedicine, telehealth, kind of evolving. Are you seeing anything? And I know Charisma having a lot of background in telemedicine and a lot of specialties. What are you seeing the telemedicine side of things playing into Retina? Are you seeing that as a benefit, a trend that's going to continue, just a placeholder? And that could be for Charisma or Doug.
Oh, I'm
sorry.
sorry.
I was referencing you both. What are you seeing with the telemedicine affecting Retina?
Yeah, Charisma, I didn't know. I'll just tell you an observation that was shared with me, or something that a physician. So I thought this physician, one physician, I sat in on a call, and I thought he was very forthcoming, and displayed a lot of a lot of honesty in his answer. He said that he has broken, what he's done from a telemedicine side is he tries to schedule all of his, again, this is just one physician, but he tries to schedule all of his patients who need to come into clinic and that actually need to, that he can't meet with via telehealth. He tries to schedule them all in the morning and have them come into the office first thing, hit the ground running. Everybody's prepared and taking their precautions. And so first thing in the morning, he's treating patients, physically treating patients. And all of his telemedicine appointments are scheduled later in the afternoon. And he said what's funny is almost all of his patients have commented to him at one point or another that he's always on time for his telemedicine appointment. And that he's not, that he actually, they say, you told me you're going to call me at 2:15, or you're going to, jump on the computer with me at 2:15, and it's 2:15. So he said, I got to be honest.
That's a silver lining. That's a real silver lining, right?
He says, I got to be honest.
Not waiting for doctors.
Yeah, he says, I got to be honest. He says, it's really kept me on task. He said, these patients normally would come into my office and they'd have a 2:15 appointment, and I might not see them just because of the way the day is structured. I might not see them until 2:45. And he said, so yeah, he says, he says, maybe it doesn't, like I said, I thought it was a nice little bit of honesty from him, because he said, I'm actually seeing patients, they have an appointment, and when it comes to telemedicine, I'm actually seeing them at the time that they're scheduled to be seen. And I thought that was interesting, because it probably is keeping, and it also keeps the appointment. He said the patients seem to, again, and then most of the folks on the same conference call, there was other physicians there, they all agreed that the patients seem satisfied. They like the idea of just being able to communicate. They don't have to necessarily physically come into the office for a checkup, as long as they're communicating with their doctor. I think, and I think it will evolve. There are certain things that, from an exam standpoint, that you just can't do right now through telemedicine. But the fact that physicians are communicating with their patients and they have a way to do it, and that they're on time, they show up when they say they're going to, it seems to be going pretty well, all things considered, from what I've been hearing.
Charisma, anything to add to that on telemedicine, just even in a general sense, seeing that benefit?
Yes, so from the doctors that I've talked to, I think some of the benefits that they're seeing now with telemedicine is that they're able to see more patients in a shorter amount of time. And I know that Doug had talked about scheduling, and they're able to have a flexible schedule, whereas I think before they have to be in the office every single day. So they can also identify some of the higher CPT codes and maybe see patients on certain days of the week via telemedicine, and versus other days of the week when they're having to see the patients in person. So there's
the
lot
ability
of
to batch, that for the clinicians to be able to batch and think through and maybe be more focused, because it's been scheduled a little differently, but basically that's a plus. Paul, anything you want to add to that, or Doug, anything else you want to add to that before the next questions?
No, I mean, I think it's a great point that Charisma brought up, that, time, even if it's just the doctor traveling to and from the office, I mean, depending on what metro they're in, it could take them an hour to get home. If the doctor doesn't have to go in the office that day and can do all of their work, do all of their telemedicine appointments from home, it might save him or her 2 hours just commuting. Right. There's so many things. I think the only thing I would add, Nathan, there's so many things that are still to be determined, that, payers, how are insurance companies going to reimburse for a telemedicine, visit or a checkup, done via telemedicine versus in person? Should it change? Will it change? I mean, really, if the doctor's doing everything pretty much, if they're able to do everything that they can via, technology that they would be able to do in person, should the reimbursement even change? I mean, so there's so many things, there's so many unknowns right now, but I think what it shows, whether it's retina or any other specialty, is that physicians, treating their patients, checking in on their patients. There's a reason why a doctor wants to see you in 30 days. There's a reason why there's a reason behind it. It's like they don't make you come into the office just for just for fun. I mean, they want you, they need to check up with their patients. They're going to figure out a way to do it. And if that means that they have to kind of figure out the rest later about, okay, how I'm going to get reimbursed for this, it's more important for them to check in on their patients, make sure their patients are doing well, than it is, even if they don't know just yet how they're going to get reimbursed for it. So I think it says a lot about the medical community. I mean, their patients come first. Obviously, they should be compensated for their time, but a lot of that still needs to be determined. So it's an interesting time, no doubt.
I think the key is that everything is in flux, and anytime a lot of things are in flux, there's an opportunity for people to make big gaps and make big leaps forward in the processes. I think a lot of times when there are processes that need to be updated, they aren't, because you get into a groove and you get into a normal pattern, and it takes something pretty extreme to get people out of their patterns. So what we're seeing, I think, something I'm seeing with specialists across the board, other entrepreneurs, this just from a scheduling standpoint, it's affected everyone on, okay, do I really need to schedule things that way or process things this way? So I think it's just interesting to see how that plays out across specialists. Last question, and we can go around the horn for the group, but what's a tip for just practice management, a suggestion for anyone that really wants to take strides during this interesting time? What's a tip for success? You can change the names to protect the innocent, or it could be a personal example. Tip for success geared towards a specialist, someone in a specialty practice, really of any kind, that you think could help someone along the way right now.
So for me, I'll give a tip. I think number one, you need to identify who your top referrals and have someone reach out to them and just say, here's what we're doing to keep your patients safe. Here's what to expect when you're coming into the office. And I think a lot of the times the offices that I talk to don't take that time. And I think that's really key in being successful, not moving forward, but just at this time. And that's how you keep the referral going. So that would be one tip for me.
I have to say, I think I've noticed since everyone is now online, everybody is used to using Zoom, that doctors now have to pay much more attention to social media, the websites, to the communication, because it's a major shift. Now everybody's comfortable using their smartphones and digital media and so forth. And so they need to reach out and position themselves as an expert, talk about the facts, talk about what to do, talk about how they are changing their practice to the new normal, because people are actually trying to research that way. And before they, make a phone call, half the time the offices aren't even open. So now they're looking for that information online. And again, the thought was always, it's younger patients. Not so much anymore. It's now all ages and all groups.
That's a great point. So far, those are both along the lines of communication and kind of, I guess, media, social media. You mentioned that's a great point, Paul. Great time to reevaluate a web presence, communication, not just advertising. I think I've seen a lot of people pull back on advertising, and rightly so. Communication and communication patterns and marketing are not advertising. So I think I've seen some people say, maybe throw the baby out with the bathwater. Hey, let's pull ads. Let's stop promoting, but don't stop communicating. Don't stop using those free tools. Don't not update your website with like Charisma you talked about, just new ways of doing business or what to expect. or questions, extra questions about, well, what am I going to expect when I come for an appointment? Doug, last word from you. What's a tip for success for a specialist right now in a specialty practice?
Well, with my marketing background, I'm more on the sales side now, but I really enjoy marketing. I love, throwing ideas around. And what Charisma and Paul just said, if I was a retina practice or advising a retina practice, at least from a marketing standpoint, my first call would be to SMG right now, because communication is paramount. And I think, in my experience, a lot of times it's not just about communicating with patients, it's about communicating with those referral sources too. If I'm an ophthalmologist who refers to a certain retina practice, I want to know what they're doing and how they're handling things. And there are some retina practices that I know well that are doing a fantastic job with this. I mean, they are utilizing social media. They're getting information out there that's accessible to both their patients and their referral sources about what to expect and how coming to the office, just a patient appointment, how it's changed, what people should be, ready for when they get there. A lot of folks, listen, healthcare in general, but with the retina, with retina especially, it's an aging population. So a lot of these people have to coordinate their visits, to the office. There's so many things that play into this. On our side, Nathan, on the software side, I think it's just a great time for practices to assess, if what they're doing works. If it's not working, where's the breakdown? I think it's a wonderful time. Like I said, I think I might have mentioned it in the last call or last meeting we had, but so many of these practices consolidated and brought they might have had 4 or 5 offices, and then they started only serving patients at maybe 1 or 2. So they brought all their drug inventory into one location, and then realized that their inventory counts weren't accurate at some of their satellite locations and things like that. Are we handling everything from, like you said, everything from how we're communicating with patients to how we're handling inventory to how we, the schedule people throughout the day or throughout the week. I think everything's up for discussion right now. It's a great time for groups, retina or any physician group to reassess and look at areas where they can improve. Because really, I think what this has brought to light with the real is that everyone has to be as efficient as they possibly can, and everybody has to do more to communicate. And those are 2 things that, without a doubt, have been brought front and center right now. Is that folks need to be have a way of communicating with their especially have a way of communicating with their patients, their referral sources, whoever it may be, other than face to face. And how are we going to do that? So, and same with us. From a sales side, we have to learn how we're going to host meetings and show our software to different groups, and your services that SMG offers. How are you going to do that without setting a face-to-face meeting? Because right now there's a lot of offices that aren't even allowing reps into their office at this point. I don't know what the CDC guidelines are. I should know that, but I don't even know that the CDC has said that it's, think about the effect that has on the pharmaceutical industry, not being able to have their field reps actually go out into the field. That's a reality right now. Folks aren't able to visit offices. Sales reps aren't able to visit offices as much as they used to. So, yeah, I would say everything's on the table, and it's a great time to reassess and look at what's working, what's not working, and whether it's a group like us or a group like yours, take the time to learn what we can do for you and see if it fits.
I think that's a great answer, and we'll start to wrap up there. The theme being, time to take stock. It's an old expression. It's pretty specific though in these circumstances. Take stock of your actual inventory, of course, but your processes, and maybe paramount being your communication with the key relationships in say your ecosystem, besides obviously how to recognize and run a practice and work with it, and still work with your team. But then each of us have sort of mentioned the marketing or communication aspect with patients, referral sources. Now is the time. So Doug, you set the bar high for how you network and how you communicate with people. So it's always a pleasure.
Well, thank
and
you.
Paul, yeah, sure. And Paul and Charisma, thanks for joining. And I'll include some links, make sure everybody knows how to get in touch with you. And we'll talk to you again real soon.
Sounds great. Thank you, everybody.
Thanks, guys.
Bye, everybody.